歡迎大家出席今日。
Welcome to today's press briefing. We have with us from the CHP Center for Health Protection Communicable Disease Branch, Dr. Shuang Shokwan, and from the Hospital Authority, Chief Manager, Dr. Sarah Ho. We'll first from Dr. Chang. Good afternoon. Yesterday, we have PCR positive tests at 3,227 cases, RAT tests, altogether 4,458 cases. So total number of cases are 7,658 cases. In the fifth wave, we have 1,123,561 cases. They are 13,497 cases and 410,064 RAT cases. Of the 3,227 cases, 337 of them are from the Hospital Authority. 323 cases are picked up by Public Health Laboratory Service. The remaining 2,527 cases are picked up by private laboratories. Well, for the Public Health Laboratory Service, we have conducted genome sequencing for 1,440 samples. We have not found any that carries L452R. For 1,427 cases, they are negative towards L452R, and 13 cases are still pending or with an insufficient load. There are 5 imported cases. Some of them are from Indonesia, arriving on the 27th of March. 2 cases, one from Ireland, arriving on the 27th of March, and also one from Vietnam and Singapore. We have not received any cases from care homes for the elderly or care homes for the disabled. So we have 285 care homes for the elderly and 285 cases for the disabled and 784 cases for care homes for the elderly. 248 cases involving care homes for the disabled homes are over 10 cases, and 730 of them are for elderly care homes with over 10 cases. Previously, we have received from 15 care homes for the disabled and 32 care homes for the elderly that have reported cases. There are altogether 9,390 residents from residential care homes for the disabled that have been affected. 36,666 residents from care homes for the elderly that have been affected. In the previous 14 days, there are 178 residents from care homes for the disabled, as well as 594 residents from care homes for the elderly. There is one positive case that have died. It's reported by the Hospital Authority. That is, they've reported 168 cases in the previous 24 hours. In this wave, there are 7,160 cases, and there are also 47 cases that are reported by outside the HA. So altogether, there are 7,207 cases in the fifth wave. 2,916 of them are females. 4,291 cases male, that is between the age of 11 and 112 years. A median age is still 86 cases. We have seen 8 cases that are pediatric patients. 96% of them are over the age of 60. 56% of them are from care homes for the elderly or for the disabled. The current reported death rate is about 0.6%. Those who have been vaccinated only 1 dose or less, the death rate is about 3%. Those with 1 dose is 0.84%, 2 doses 0.12%, 3 doses 0.02%. That's all for my report today. We'll now hear from Dr. Sarah Ho about the hospital authority. Currently, 11,043 patients are staying at hospitals, at the community treatment facilities as AWE, the North Lantau Hong Kong Infection Control Center, as well as the Infectious Disease Center of the HA. Last night, we have reports of 19 patients that are in a critical condition, 32 in a serious condition, and 108 critical condition patients are in ICU. As at midnight, in the previous 24 hours, there are 143 patients with a positive result that passed away, 87 male and 56 female. Age range is 51 and 100. Of the people who passed away yesterday, 70 of them are from elderly home, from residential care homes. 80 of them have not received any doses. 42 of them have received 1 dose. 19 2 doses, and 2 cases of 3 doses. Well, there are 130 of them are above the age of 65, but we have 1 male that is 51 years old, suffering from a heart condition, with something to do with the heart valve, and also a cancer case. The age is a bit young. The other one is a 55-year-old female suffering from renal failure and relying on the renal dialysis on the long term. The other one is a 56-year-old male also suffering from cancer. The fourth case is a 57-year-old female. She has a history of stroke and relies on feeding by tube. The other one is a 58-year-old male. They are from care homes suffering from chronic illnesses. And there was a history of drug abuse. So it's a carrier of hepatitis. For these patients, they suffer from chronic illnesses or are cancer patients. So they are prone to complications. In relation to data backlog, so we will report the cases between the 16th and 26th of March. 25 patients have passed away, 11 male and 14 female, age range 63 to 99 years old. In the previous day, there are 411 patients that have recovered and been discharged. We have also about 10 patients that were tested positive upon admission screening. There are about 10 patients in the same ward are classified as close contacts. In relation to staff members, so far we have 20,840 staff members that have been tested positive, and 17,310 of them have already resumed work. Now it's question time. Please raise your hand and use the microphone. We have you. Before you start, please identify yourself. The gentleman at the back.
And good afternoon, Phoenix TV. For the Qingming and Easter holidays are approaching, would you anticipate that the epidemic situation that we have like a rapid surge like after Chinese New Year? And recently, we're seeing the real-time reproductive rate and commuting has increased. Well, in terms of cracking down on group gathering and mask wearing, do you see the government has put into enough effort? The epidemic situation still reporting lots of cases. Well, today we have over 7,000 cases. I believe that the unreported cases or the asymptomatic cases are still considerable. If we're seeing more people out and about, we might risk a deterioration. This is something we are worried. I know that the Hong Kong U is looking into the real-time reproductive number. If it exceeds 1, we see a rebound. Cable news. The chief executive said by common sense that the infected cases should be more than 1 million. With a quarter of the population infected, do you agree with this? Would the administration consider when calculating the mortality rate, you will use the expert projection instead of the actual number of cases to lower the death rate. And on the death cases, according to the latest analysis, how many of the deaths are not directly related to COVID? Do you know the breakdown? For those not directly related to COVID, will you consider deducting them from the death figures? And coming up, there will be quite a few public holidays, and there will be more people going out. Well, for the 21st of April relaxation, any chance of it being delayed? I believe that the reported cases has exceeded 1 million, and lots of universities are doing their own modeling. Maybe for each case, there are always several cases behind it. Therefore, the total number infected in the community should exceed 1 million. Of course, we don't have an exact figure, as this is all mathematical modeling. So far, we can only use the reported figures. And for the analysis of death cases, I'll let the HA supplement. For the death cases in the fifth wave, we're currently conducting some analysis. For example, whether the patients were vaccinated, cases are vaccinated, or any underlying conditions, or any case that did not resuscitate. We need to examine each case carefully, and we will also conduct some analysis from the preliminary data. For this wave, most of the deaths were seniors, and some of which did not vaccinate. And for the details as for whether they did have their own underlying conditions, we're still pending further analysis. From the current data, lots of them were unvaccinated. Therefore, once again, I'll appeal those who are unvaccinated that they should get vaccinated as soon as possible. The next lady on the far back. News. 2 questions. First, the government expert, Mr. Gabriel Lau, noticed that the infected elderly were waiting to be admitted at a department. Due to the shortage of beds, they were transferred to the holding center, then were later transferred to the makeshift hospital or the holding centers. So within 2 weeks, an elderly was transferred 4 times. And how do you resolve this chaos? And how can you better manage the utilization of beds? So 3 months into the pandemic, and there were 7,000 deaths. Did the government consider additional measures to reduce severe cases and death cases? And second question, some experts suggest that all residential homes for the elderly and the disabled, when reporting the number of residents vaccinated and how many shots and how many residents and family members disagreed with the vaccination and why. Well, by disclosing such figures, it will be beneficial to the government and the residential homes, that the public can also monitor the situation by disclosing the daily figures to motivate a better elderly vaccination. Do you see this as feasible? Well, with such a high death rate, have to do with the unvaccinated seniors. Let me say something first. To reduce the mortality rate and severe cases, this is a must. I know that we are working on multiple approaches. The key is to get vaccinated. Just now, Dr. Ho and the numbers have demonstrated that majority of the death cases were unvaccinated, and the difference between vaccinated and unvaccinated is huge, and therefore that we see that the vaccination as important. And the second aspect will be early treatment, early identification and early treatment can reduce death rates. Dr. Ho? over the past 2 weeks, we have implemented a lot of measures. The government have created a few holding centers. The hospital authorities have devoted half of the AED beds to designated beds for confirmed cases. We designated a few hospitals, for example, the Queen Elizabeth Hospital as a COVID hospital for confirmed cases. For these measures, we need to do a lot of coordination. For example, some of the elderly residential home residents, if they were preliminary positive, our community assessment team are providing support. For the severe cases. They need to be admitted, and they can be admitted through the A&E departments. And for the mild cases or after treatment, they have stabilized and fit for discharge. By the 7th day, they're tested negative. If the residential homes can arrange, we can return them to the residential homes. If by the 7th day they are still tested positive and yet they're in a stable condition, we will liaise with the social welfare department, and they will arrange these residents to the holding centers. To further reduce the viral load before returning them to the residential homes. Well, this trial started this week, and our communication and coordination will improve over time, and hope that there will be a smoother cooperation down the road. Next, the gentleman in the last row. Mingpao Daily News. First, I would like to ask you about the death rate. Just now, you just gave us the daily death rate. Sometimes you'll refer to the mortality or the death rate, and what is the difference, and which is formula? So which will be the more accurate wording? And according to Professor Ivan Hung, according to the HKU projection, there will be over 4 million cases infected. We should use that to calculate the death rate. According to this, then the mortality rate should be around 0.18%. Will the administration adopt this approach? And how would you respond to this proposal? And for question for HA, according to the death case analysis, when will you come up with the first phase of findings? According to the death case analysis, what kind of treatment might be beneficial to them? In terms of the naming, well, there will be the death rate of the reported cases. Well, so far we don't know the exact death rate of the reported cases. Some experts suggested using an estimate figure to calculate that. Of course, this figure can be of reference. However, we do not have an exact figure, therefore we do not have an exact denominator. What we can do now is to use the death rate of reported cases. Well, these are of also reference value. For the death case analysis, this is not unique in Hong Kong. In the US and in Singapore, they will keep reviewing the death figures. For the death cases, we have appointed our experts, including the different clusters and the professors, to examine each case from a time of admission and their treatment in the hospital and any underlying conditions and their vaccination history. All this data will be considered holistically. And through this research, we hope to receive more information on better treatment in the future. Well, so far from the data collected, that lots of the death cases were unvaccinated, Therefore, at each time, we will remind the public that they should get vaccinated as soon as possible. We are going over much in detail, and we will announce it in due course.
Next, the lady at the back. I'm from TVB. I'd like to ask this. There are parents saying that, well, with the fifth wave, they cannot accompany children to go into hospitals. When the children have been released, there are some signs that they may have emotional problems. Well, how are you going to address their concern? If there is insufficient space, well, would you arrange for parents to let them accompany children when they are admitted? Regarding children and the chaperone, well, we have attached a lot of importance to the needs of children in having their parents with them. As you understand that at the start of the fifth wave, it came very suddenly and very quickly. There were a large number of children that were admitted. We had to make an assessment of the use of beds by pediatric patients as against the need of someone accompanying them. Now that the epidemic situation has somewhat alleviated, wherever possible, if the child is infected and if the parent is infected, we will arrange for them to stay together. But if the child is infected but the parent is not, we'll ask the parent what they would like to do, and with the approval given by the CHP, we will make arrangements for parents to accompany their child. We have asked about the situation in hospitals. Well, such requests have in general been met. So we would try to take into account their needs and try to accede to their requests as far as possible. I'm from AM 730. I'd like to ask about the 5 younger death cases. What about vaccination, admission date, as well as whether they die with or die of COVID? Someone mentioned about an increase in people going out. Well, what about advice to the general public apart from avoiding cross-family gatherings as well as wearing masks? Would you advise them not to go to shopping malls? Just now, a fellow reporter asked that there is a difference in the term used in Chinese referring to death rate. So can you elaborate? What about designated hospital? Well, is it the case that the conversion of Rutonji Hospital as well as Haven of Hope will be suspended? What if there is indeed a need to go out? Perhaps, as you said, that it would be better for people to go out in the open in the countryside than in shopping malls where there are more people. Well, for the death rate, sometimes is based on the population, not those that have been infected with the virus, because well, death rate itself is a very common name. It doesn't have a special connotation referring to a certain thing. Well, the denominator is the number of cases, and the denominator is currently the infected cases. We just want to give you a more accurate picture. 3 of the 5 cases have not received any vaccination. 2 had 2 doses. Date of admission. I don't have the information with me. Next question. I'm from Orange News. First, this morning the chief executive said that during RTDs in this wave, about 35% of the people did not comply with CTNs. Well, have you conducted any analysis as to why? And how many prosecutions have been initiated for failure to comply? We've seen a recent drop in number of cases. What is the appointment situation for designated clinics? Has there been a drop? Well, for the 2 oral medications, how many prescriptions have been made? Have you received any reports about adverse events subsequent to the usage of the oral medication? I don't have the figures in relation to non-compliance under restrictions and testing declarations, but I believe the relevant department will follow up. About designated clinic, as at 1 p.m. on the 28th of March, the 23 clinics have served 96,000 consultations. 12,000 sessions were referred to us using the caring appointment system. Let me put it this way. If people feel unwell, they can make use of the designated clinics by making an appointment to see a doctor. Apart from telephone appointments, we also have an app, HA Go. You can make an appointment there. Some patients told us that it's quite easy to use. So you may consider using the app to make an appointment. For elderly patients, we have a caring hotline. Priority is given to high-risk groups. For those who meet the requirements under our guideline, we will make arrangements for them to receive oral medication. This will reduce the chance of the case getting more serious. We have prescribed over 19,300 patients these medications. So far, we have not received any reports about serious side effects. Let's take an English question. The lady at the back.
Good afternoon from the South China Morning Post. Dr. Chuang, yesterday we asked Dr. Au about the CT value cutoff for inbound travelers. He said there wasn't one, but health experts who saw the clip said there must be. Can you tell inbound travelers trying to test before they arrive what the CT value cutoff is in case they test positive on arrival? And my last 2 questions are for Dr. Ho. So Dr. Tonico said that about 40% of people died of COVID in the hospital authorities' preliminary analysis of fatalities. So will the HA adjust the city's case fatality rate in the future? Can you explain how health officials determine if somebody died of COVID or not? How many deaths were analyzed in the preliminary findings, and when will we have the official findings? And lastly, MindHK said they estimate that 1,500 to 2,000 child COVID patients are currently separated from their parents. Can you confirm if this figure is correct? If not, what is the figure for the 5th wave as a whole and the number at this moment? Thank you.
I understand the CT value depends on individual laboratories. So we do not have a hard and fast CT value to cut off whether it's a negative or positive. HA all along follow the pro-family and pro-family policy. In fact, we always understand the need of those minor, that is less than 7 years old, or some children with special needs such as ADD, ADHD child. So we always try to allow the carer or the parents to stay with the minor child. But during the 5th wave, and it's unprecedented demand on HA service, including the pediatric service. At that time, we faced either child who are in need of inpatient service, and at the same time, the parents stay with the kids. So that's why a very difficult situation at that time. So as the demand lessened at the moment, I've checked several hospitals. In fact, I understand quite a number of parents are staying with the kids. So either if the parents are also confirmed positive, we will try our best to arrange they stay together inside the same ward. So in case the parents are negative and the child positive, and we will explain the risk of getting infected and got the permission of CHP, and then we will try to also arrange them staying together in case they have the wish. And for the expert panel on reviewing the mortality case, we are still doing the reviewing process. It includes a very meticulous process, including reviewed admission process, the symptoms, treatment, investigation, vaccination history, and also underlying medical diseases. So it may take time to analyze the case by case. And if we have the conclusion, we will announce later. I don't have the data on hand.
下一位嗰邊
Next, the lady in the front. HK01. Just now, it was mentioned that the deaths outside the hospital were 47. Can you tell us about more of their circumstances? And second, and for those patients on oral medications, do they report less side effects? Do you have any kind of reports or statistics? Well, I have the first 42 cases. Well, for the death outside of HA, 27 male and 15 female, age 51 to 98, 6 of which were residential home residents. 88% did not have 2 doses, most of which had underlying illnesses. Our forensic pathologists had done some preliminary analysis, 4 of which were died with COVID, and some yet to be determined, and certain percentage died of COVID. For the oral medications, well, from the foreign data, they can reduce the mortality rate and the need for hospitalization. Our designated clinics still have appointments available, and therefore they are open for bookings. And the oral prescription were given to infected cases. Is best for prevention and better than cure. Practitioners will come to Hong Kong to assist in the anti-epidemic efforts. When will they arrive, and what kind of work will they do? For the Chinese medicine practitioners, and since mid-February, we have provided Chinese medicine service for the care home residents, and in late February, we set up a Chinese medicine consultation hotline in which the registered TCM can provide consultation service. And a bit earlier, some of the recovered patients were offering at 10 Chinese medicine consultations for them. The mainland medical team TCM experts are eager to come to Hong Kong. In 2021 January, the HA in its community treatment facility and the and the North Lantau Infection Control Centers provided a special consultation for inpatients, which we provided Chinese medicine treatment. And so far, 170 patients took part and provided 950 consultations. So that is the current situation. And that's the end of the press briefing. Thank you.